Hey everyone, thanks again for joining us today at HNC Let's Talk. I'm Dexter Brooks. All right, let's get started today. Today we're going to discuss how can doctors, nurses, and other care providers help patients get past social barriers to care. Americans want healthcare providers involved in food, housing, transportation needs. It's not just medical care anymore. It's not a third of Americans are so much stress just trying to keep roofs over their heads, food on the tables, and reliable means of transport available when they need it, that they would welcome their healthcare providers' help. That's according to Kaiser Permanente Social Needs America survey, which finds that 68% of Americans have experienced at least one unmet social need in the last year. And more than 25% said an unmet social need was a barrier to health. 21% prioritized paying for food or rent over seeing a doctor or getting medication. The survey asked respondents about what stood in their way in making sure those social needs were covered and how that impacted their being able to get the health care they needed. It also asked how they wanted doctors, nurses, and other care providers to help them get past those barriers to care. According to Kaiser Permanente, they think holistically about health, which includes medical care and other factors like access to food, transportation, and housing. By helping close the gap on social needs, we have an opportunity to advance the health of communities across the country and safeguard everyone's right to thrive. Among other findings is the fact that Americans look upon those social needs as just important as medical care. 89% of respondents said safe and stable housing is very or extremely important to health. And 80% said reliable transportation is very or extremely important. Those who aren't able to keep up with those social needs are more than twice as likely to classify their health as fair or poor as those who are more secure. In addition, a third of respondents say they're stressed over social needs, with 28% reporting that a social need kept them from getting care in the past year. Stress levels were high over getting enough food or balanced meals. 39% said social needs got in the way, and 35% say they're stressed over housing. Another 97% say that medical providers ought to be asking about social needs during medical visits, with just 10% saying they would feel nervous or annoyed by such questions. We must ensure individuals have access to health and social services they need to be well. When we ask our members if they have had to skip a meal lately, if they can't afford the medications, or if they have reliable transportation, we know the answer to those questions can tell us as much about their future health as their blood pressure tells us. When we can prevent negative health outcomes with access to social services, we can make our communities safer. We can make our communities healthier. To learn more, visit us at www.healthnetco.com/HNC-news. Thanks again, everyone, for joining us. I'm Dexter Brooks.